At this time, I'd like Dr. Tenya Blackwell. She's Director of Community Engagement at Ashe Institute for Urban Health. She's going to come and talk to us about the role of social determinants and stress in regards to diabetes. So give her a hand as she comes forward. Thank you so much.
Thank you. The pointer is here. So I just have like one question. Like, why are our communities sick? We're hearing a lot about the flu, we're hearing a lot about diabetes, we see the statistics of high rates of diabetes in Brooklyn, but my one question and main question is, why are our communities sick? And so I'm gonna spend just a brief minute talking about the social determinants of health. When we hear from the physicians and the clinicians, we hear maybe some of the medical determinants of health, and here particularly with diabetes, sure, high sugar, high A1C, uncontrolled insulin, but I want to talk about some of the social determinants of health. And so the Center for Disease Control and Prevention coins the social determinants of health, those social things in your social environment, things in your living environment, the conditions in the places where you live, where you work, where you learn, where you play, where you worship. All of these things have an impact on your health, and they actually have a more direct impact on your health than medical treatment. We also know, and this is from the CDC, we also know that differences in health are striking in communities with poor social determinants of health, such as unstable housing, low income, unsafe neighborhoods, or substandard education. Dr. Afabo just mentioned that diabetes is associated with city living, and she showed some information about central Brooklyn having high rates of diabetes. But when you look at New York City Department of Health data, you'll see that Central Brooklyn have high rates of everything. Diabetes, cancer, HIV, AIDS, you name it. Central Brooklyn is high in all of those health outcomes. I shared with Borough President Adams some years ago about my father. He lives in North Carolina. He manages his diabetes well, and he shared a story with me that when he was first being diagnosed with diabetes, his doctor leisurely said, oh, well, you know, black kidneys don't last. I'm like, what? Black kidneys don't last? Well, why black kidneys don't last? And what's the difference between black kidneys and white kidneys? I mean, and they're even the same color. What's the difference in the black kidney and the white kidney? But there are conditions in which people live and work and play that some populations deal with more than others, and those are the things that impact our health much more negatively. So this little chart here, let me see if I could point. We're going to go around, and so it says 80% of individuals' health is determined by behaviors and the social and environmental conditions in which they live, work, and play. And so we see here on this chart, factors that impact health and well-being, 20% of that comes from your clinical care or going to a doctor. 10% of that is attributed to your physical environment, what's around you. 40% of that, and so here, physical environment, like your neighborhood, safety, isolation is even a social determinant of health. Social isolation, sometimes we have elders or just folks who are less connected than others. Everyone may not have a church home, or everyone may not be involved in some social group where they're connected. And even that social isolation have negative impacts on one's mental health, their well-being, and their levels of stress. 40% being your social and economic factors, your income, your job. One of the things we study and we see in public health is one of the main things we look at is, okay, well, what's an individual's income and their socioeconomic status? And your income and your socioeconomic status alone directly impacts your health, your education level. Things like transportation. Here in New York City, you would think we don't have much issues about transportation. We have many trains and buses, but that's not always true. But in other more remote places where there isn't an intricate transit system that we have here in New York, if it's running properly, to get to things, to get to a doctor or to get to a pharmacy or to get to medication. So one's transportation or lack thereof is a social determinant of health or something that impacts their health negatively. Housing. Housing is a huge one. Do you live in housing where your indoor environment is toxic and there's mold and there's pests and there are other things that can impact your respiratory health? Or are there aspects of your housing like availability or homelessness or affordability that causing stress levels that then directly or indirectly impacts your health? Again, language, literacy. If I, from a non-English speaking country, and English is not my first language, or my doctor, English isn't his first language, there's a gap in my ability to communicate with him. And so language and literacy impacts your health. Your access to health care. Again, hunger. All of these things, believe it or not, have a higher impact on health than whether you see a doctor or not. I'm sorry that this looks a little bit blurry, but this just breaks it down. Again, what I just said, whereas 10% of the things that impact your health are coming through your environment, 20% of that, the medical and your medical care may address 20% of the total impact of your health. But again, health behaviors. We heard a lot about plant-based diets and how we're programmed to eat poorly, or culturally we're programmed to eat a certain way. That's an impact on your health again, and then 40% your social and economic factors. However, with 20% of medical services impacting your health, it's getting all of the investment when it comes to investing in health and in healthcare. Direct medical care services, 95%. So the investment in health. I heard somewhere in some countries, doctors are now prescribing fruit and vegetables as a prescription for diet to deal with certain chronic disease. But that's not happening here. We're attributing a lot of our financial dollars to just the medical care and not behavioral or those social and economic factors, as we should. So again, this is just another breakdown of those social determinants. Again, income stability, your employment, your ability to even go to see a doctor. There's times where we would forego seeing a doctor because I don't really have the $30 or the $50 to spare in a copayment today. Or God forbid my prescription is such that it's outside of my budget for this week, right? Or the neighborhood or physical environment. I mentioned housing and transportation, safety, parks, playgrounds. If my neighborhood is not safe, I'm not going outside to walk and exercise or go to a park or take my children outside. Education, literacy, language, childhood education. If the education system is not what it should be, then I'm not going to reach a level of education or health literacy to help me improve my health. Food and hunger. We're learning a lot about plant-based diets. And so having access to healthy food. Borough president, he always talks about Park Slope having Whole Foods, but Brownsville having junk food. I'm from Brownsville. My friends and my family and my network and my community, my church family are there now. And so having a whole food or a fresh food market, or the lack thereof is impacting, or a swamp, a food swamp, a neighborhood where every 30 feet there's a toxic fast food establishment. And so we don't see that, we see much more of that in central Brooklyn neighborhoods than we do in others. Again, and then those social systems and your social networks and your connections and how connected are you, or the healthcare system, how culturally competent are the physicians that we see, and my ability to have a conversation with them, or his ability to reach me to provide me some education about diabetes management or care. And so this, I'm gonna skip through that because it's just another picture of the same thing, different types of social determinants of health, childhood experiences, adverse childhood experiences, and trauma that just cause a cascading effect of so many other things. Again, housing, education, social support, some of the things that I just said. So of all the social determinants of health there are, and there are many, and this presentation today is not the time or the space for it, but there's another one of racism as a social determinant of health. But all of the social determinants can be pretty much categorized into three main categories, and one of them being income inequality. If this map of the US depicted how the wealth of the country was divided, you would see the 90% of us, this is, we just, occupy this portion of the United States. But the wealthy 1% is occupying a large chunk of the land, where the lower 9% would own this much of the land. So if the land was divided into wealth, that's just a depiction of how unequal income is divided in this country. The second one, another most important one, social connectedness. Studies show that belonging, whether to a large extended family, network, friends, churches, faith-based, sororities, that's related to longer life because of the connectedness. It's related to longer life and better health, as well as to community participation. Again, and then environmental quality. While clean air and clean water and healthy soil are all necessary for good health, location also has a lot to do with whether people receive services or not, or if they are exposed to toxic chemicals or not, or if they're exposed to toxic food or not, or if they're exposed to toxic water or not. And this is my area of research, environmental health, so I'm really passionate about this one. And this one here, my neighborhood is killing me. Why is it that city living is associated with diabetes and other chronic diseases? And so I always like this slide. I say a tree grows in Brooklyn. There was a commercial years ago that says, I think it's a book, it is a book, that talks, it's a long story, but a tree grows in Brooklyn. And so while many will paint the picture of Brooklyn being not a healthy place, or having its stigma to Brooklyn, we do have health. We can see health come out of Brooklyn if we're planting the right roots. And so we see a tree here that's bare, at its roots. We have adverse living conditions, housing, poverty, segregation, unemployment. And what are the impacts of that? The outcomes of that? Stress, depression, obesity, and everything that we're talking about here today. But if we were to plant the proper things at the root, be it access to healthy food, quality schools, access to recreation, adequate income, access to health care, then our tree blossoms in a much more healthy and productive way. And so a tree does grow in Brooklyn, a healthy tree does grow in Brooklyn, and I'm believing that we here will be able to address the diabetes crisis that we're facing here in Brooklyn. Thank you for your time.
Thank you so very much for that presentation. I learned a new word, food swamps. I never heard of that before. But I am very familiar with seeing all the junk food around. So I thank you so very much. That presentation was very informative. And it also reminds us of the importance of staying connected and connecting with people, even, especially when you don't see people in church, you don't see them in service, you don't see them at the corner store. Reach out, because it's so important to stay connected. It's so vital to our health.